It's morning and the loading dock is bustling. These supplies need to be checked in and sent to the floors where they're needed.
I had to break the bins down that we did from Detroit, and then when the trucks come in, we have to unload it and then put all the other stuff inside the computers.
Everything must be tracked, and Christine says it's her favorite part of the day.
I don't know, it is something that's fun to do, to come in early in the morning and knock the stuff out and get your day over with.
Christine started at Covenant through the Saginaw Intermediate School District. They have a vocational program at the Transition Center that helped her not only learn job skills, but actually get work experience at a local restaurant.
We have different levels of our Covenant group. So our first level is our students come into the work-based learning program and they just learn strictly job skills. If they do really well, they move into a 7-week paid position over in Covenant during the summertime. Out of those 7 positions, 3 of them earn an internship. So that's a year-long program, paid positions.
Nearly 100 students have found a paid internship at Covenant since the program began. Those jobs currently include housekeeping, supply chain, and nutrition services. Many of those workers are so good that they get hired to work permanently at Covenant, like Christine.
I have fun with doing my job. I like working with different people and knowing different people around the hospital.
You might not know it, but this is a big change for Christine.
She's not as shy as she was when she first started. Definitely opened up. I think that it has a lot to do with being in distribution because this is a on-the-go department. The other employees that she works with, I'm sure they've had a big impact on her.
It's so awesome to see these students that they come in at their junior year, and then when they get to their senior year, you see this huge growth and this huge maturity and this competence, and it's such a cool program to be a part of.
Down in Cooper's lower level, Bryan is taking in a fresh load of clean laundry.
My responsibilities are taking linen to the Covenant areas and delivering to the nurses and other rooms that need it. We give them the scrubs or linen.
Bryan handles everything from blankets to scrubs, which need to be sized so staff can find them easily.
Get them what size that they need and you just deliver.
Bryan admits his first interview at Covenant was a little rough, but he did get the job and continues to learn.
Bryan was one of those students that was very determined. He came in and he worked at Covenant for one marking period, and he said, I'm going to work at Covenant. So that was his dream right away. And so we said, okay, well, let's do this.
Bryan knows his way through a confusing system of hallways and elevators, where he likes saying hello to patients and friends.
My most favorite part is working with my employers and with my coworkers.
Another part he loves is the paycheck.
My job helps pay for my car, for my insurance, and it helps me pay for my house.
The Transition Center's main goal is helping kids with disabilities learn to be independent. Covenant has found it's a great place to find amazing employees.
First and foremost, I think it was giving opportunities to kids who perhaps would not have had opportunities elsewhere. And I'm certainly very proud of Covenant HealthCare to provide opportunities for these students. It's provided us with really an untapped supply of employees that have performed exceptionally well. They come to us highly trained, highly motivated. I think that our turnover rate for these students and employees is less than 10%.
Each of the departments that train students agree.
If we could get other departments to possibly think of opportunities within their department that these students could come in and be a part of, that would be great.
This program is absolutely amazing. It's so fun to see the kids start at the beginning of the summer and be super nervous and shy, and they don't want to talk to anyone, and they just kind of walk around. But by the end of summer, they've got friends and they talk with everyone, and they've just softened up and they become a part of our family.
Bryan says not everyone tries hard enough to succeed. He has advice for other kids who struggle with finding a job.
My tip for you today is keep on working and soon you will get there. Without the transition center, I wouldn't be here today.
As for his man in linen, Jim hopes he'll stick around for a while.
I hope Bryan is one that will be retiring out of here in 40 years.
There is a good chance he'll be here. Nearly 3 dozen former students are employed here, some for over 20 years. Many move on to different units as they discover new interests. Bryan St. graduated from the program in 2014.
He did the internship, and he did really well there, and he was hired in nutrition services. So then he wanted to keep going. He was doing so well, and he said that he couldn't see himself just working in the kitchen. So he went back to school to Dorsey and became an EKG technician.
No one is more surprised than Bryan, who told all his friends at Heritage High School that he was going to be a video game tester. Now his heart is into helping patients.
I recently just did a rhythm trip where it kind of looked funny to me, and I end up showing the nurse, and the nurse is like, "This patient's having a heart attack as we speak. And we appreciate you running a rhythm trip because we would have never caught it in time." And I'm like, okay, that's awesome.
Bryan knows that life is full of challenges. The trick is never quitting.
You can't just give up automatically and just say, oh, it's too hard for me, I'm just going to give up. What I basically told my coordinator is you got to keep pressing forward no matter what. And if it's hard for you, ask for help, ask for family support, but you got to push forward no matter how hard.
Bryan now has his eyes on an even bigger challenge. He'll go back to college.
I'm planning on going back to Delta to finish my basics and to start on my surgical tech, my next step.
It's just amazing. It's just the amazing support that we have for these kids that people don't know, and they don't believe that these students can do these great things. And I think our program shows that they can do it. So we break down these barriers that they put up for us. And it's an amazing experience and adventure, and I'm very, very lucky that I am able to go along on this path.
We've got people that have been here since the very first summer program that went on 20-some years ago. So it's really, really nice to see, and I love going down the halls and seeing people that went through 5 years ago that used to come empty my recycle bin in my office, and now they've got a full-time job in supply chain or food nutrition or EKG. Like, that's really, really awesome.